Hi, doctors. This brief slideshow is part of your orientation. We're going to talk for a few minutes about how to complete your charts when you're in Epic so that you can get paid. Patients who require more than 30 minutes of our undivided attention qualify for critical care billing. We use the codes 99291 and 99292. A patient does not require the same kind of documentation on his chart for critical care. Also, they don't need to be unstable, merely that they may become unstable without your intervention. So we chart as best we can, but we don't need to fill out every template item like we do in levels 1, 2, 3, 4, and 5 when we're doing a critical care patient. The important thing to do is document the number of minutes that we spend on that patient. When you spend a total of 74 minutes or fewer on a critical care patient, you use the critical care charge 99291. If you spend over 75 minutes on a critical care patient, you'll be also adding at least one 99292 charge. We'll go into that more in a second. On the procedures tab, you'll see the list of procedures, and you'll see critical care. And as that box opens, you'll be given an opportunity at the top to enter an actual number of minutes. This is very important, and it's the only place that counts towards your billing, to enter the actual number of minutes right here. Also below, you can see that you can enter more details about your critical care. Well, let's go through a couple of examples, because I'm so good at math that I can surely teach you something here about numbers and adding. So for 90 minutes of critical care, we would bill the first 74 minutes using the 99291 charge. And I'll show you what that looks like in a minute on the Epic template. But that leaves you 90 minus 74. That leaves you 16 additional minutes of critical care that you want to bill for. So then you will add one 99292 charge. You will add one of those 99292 charges. So let's see what that looks like. In your Epic charge capture window, you'll focus on three areas. At the center of the page, the middle circle, the physician LOS charges, is where you will enter your first 99291 charge. The top circle, where it says critical care, is where you will enter additional minutes of care, the 99292s. We'll see that in a moment. After you enter those charges, down at the bottom circle there, you will hit a little button that says File Charges, and I'll see that in close-up in a second. So first you'll find the first critical care charge. Click there for your first 74 minutes. That will leave you 16 minutes of critical care that you still need to bill for. So look on your charge capture sheet and you'll see a menu of items, one of which that big green arrow is pointed to says critical care. Open that up. As this box opens, you will see where that big green arrow is pointed straight down, PR critical care additional 30 minutes. That is where you add your additional 16 minutes over 74 minutes. There's just a close-up of where you add your PR critical care additional 30 minutes. And then after you do that, you'll go down further on your screen, and here's a little close-up of it. You click File Charges, one of the most important buttons you will ever push. So let's try again with a different number. What if you're doing 105 minutes of critical care? Well, 105 minutes of critical care is equal to your first 74 minutes, which is a 99291, plus an additional 30 minutes, which is a 99292, but that still leaves you 1 minute. So you're going to have to click a 99292 again, and then hit File Charges again. I'll show this. So first click your first 74 minutes of critical care, add your first additional 30 minutes of critical care, and then click File Charges, just like we did earlier. But to add your last 1 minute of critical care, you're going to hit the PR critical care additional 30 minutes. You're going to hit that again. You're going to click that again, and then click File Charges again. And that's how you do it. To summarize, this means if you're doing 29 minutes of critical care, that's a level 5. If you're doing 74 minutes of critical care, you enter a charge of 99291. But if you do 75 minutes of critical care, you charge a 99291 and a 99292. Similarly, if you do longer 30-minute sections of critical care, you add one charge of 99292 for each 30-minute block. As you know, critical care time does not have to be continuous. It can be interrupted for care of other patients, restroom breaks, spaz attacks. And critical care time includes your time at the bedside, your time reviewing data, and talking to family and consultants and admitting doctors. Critical care time also includes time spent thinking about a patient and reviewing some of these examples shown here. What you do not include in critical care time is time at bedside spent doing separately billed procedures like intubation and central lines. Patients who are crashing and patients who may crash without your intervention include heart attacks, CHF exacerbations requiring BiPAP, patients who need IV multiple boluses and drips for malignant hypertension or AFib RVR, patients who need multiple nebulizer treatments for asthma, patients who need IV insulin and fluid drips. These are all critical care patients that eat up a lot of our time and thought and should be billed critical care.